Hello, thank you for being here today. I'm going to talk to you about headaches, especially tension type headaches. These headaches could be described as tight bands on the top of the head, increased pressure on the base of the cranium, or pulsating pain on the temporal region. The intensity of the headaches could change. Also, the frequency of the headaches could be different. So sometimes it's episodic or chronic headaches that could be lasting for hours. It is important that you consult with your doctor if these headaches have become chronic and they're affecting your day-to-day life, okay? You will notice that it's more difficult to focus, you will feel fatigued, you will feel irritated, your appetite could change, you wake up not rested in the mornings. I'm going to share with you some tools that I use for headaches. Let's start by explaining how important it is to keep the muscles in our upper back and neck and even the cranial muscles relaxed. Just to promote good blood flow into the muscles and to have good flexibility and no restriction on movement on our neck. I use this head massager. It's just to stimulate the receptors that we have in the cranial area. This is a manual one, but we could have one with battery. You could use this 3 times a week. It depends on the frequency of your headaches. It produces a really nice relaxation effect, okay? Also, to take care of our muscles in our back and neck, we could be using an electric percussion massager. There are many in the market, so choose something that is easy for you to use, that is not too expensive, and that you try and you enjoy. So the idea is that we try to take care of all the muscles in our upper back and our neck, okay? Even sometimes releasing the front of the shoulder and the chest is helpful. We could be using something like a cane also to do the same thing, just to apply pressure. You could use a corner on the wall just to go on those muscles next to the shoulder blade to find tender spots or sensitive spots. You know how much I love the tune-up ball, so the self-massage for the upper back and neck, I already have another video on YouTube that you could follow. Also, taking care of the tension on the base of the cranium is really important, okay? So I use something called a still point inducer. And the idea is that we place it on the base of the cranium and you just lie down for 8 to 10 minutes. It will be done 3 times a week. These tools, we use it in craniosacral therapy, which is also another technique, a kind of therapy that helps a lot with headaches. There is a softer one that is red. This one is a little firmer, and we could also use something like this. Okay, but if you have the tune-up balls, you could use the tune-up balls also on the base of the cranium. It depends on how sensitive you are, and you will just choose the tools that fit you better. You know that I love acupuncture and using acupressure point stimulation. So the point in our hand, large intestine 4, is really good for headaches. You could apply the pressure when you have the headache or when you're feeling that the headache is just starting. You could use an AcuPen. So this is a pen just to produce electrical stimulation. This one uses batteries. There are some that you just charge them with an USB charger. It has different settings, so you could go to different levels of stimulation. 1 or 2 for me is enough. So I could just place it on the spot and allow that to work for about 40 seconds to 1 minute, okay? You see how the trigger point is active. You see how involuntarily moves my fingers. I could use this also, trying to find tender spots or trigger points on the upper trap or on the back of the neck. The main purpose of this is also stimulate the point by increasing the blood flow into the area. When you work distally on your hand, you're stimulating the meridian, the point through the meridian. You also know how much I love cupping. There are different sizes of cups. I keep them in the shower. When it's for my neck or my upper back, I use these two sizes. This is the small and the extra small. Basically, you use soap, and you use the soap to help to allow the cup to slide. You just squeeze the cup and place it on the tight muscle, and you just start doing few strokes and do the same thing on the other side. It is very important to think about the position that you're using through the day. So if you're working in a sitting position in front of the computer all day, try to take breaks. So every 45 minutes, just stand up and walk around the chair or go for a glass of water. Also, how are your shoulders? How is your neck position? So our shoulders have to be in a slight retraction, okay? That you feel that the chest is open. You want to avoid elevating or rounding your shoulders. If you find that it's very difficult for you to keep that position, maybe you need something else, something extra to help to support you. It could be just tape on the back of your upper back, or it could be something like a strap, posture medic. This is to avoid the round position on your upper back. So in here I have the posture medic on. You can see that it helps to push my shoulders back, so I don't have to be thinking about that all the time. But I don't recommend that you use it all day long. I want you to use something like this on and off, so you're really working on your muscles, okay? You could use this as a strengthening tool, so you could just keep your shoulders next to your body, your elbows on your waist, and you just do external rotation of your shoulders. Or you could use as a resistance band to do this through the day. This is again for somebody that has to be in sitting for a long period of time. Or if you have to be doing repetitive movement with your arms in front of you, so a good strengthening on our upper back musculature is important. Also, to work on your neck muscles for strengthening is enough if you have your hands holding your head and you just do a slight retraction. So you could see me from the side. You could be doing this about 10 repetitions 3 times a day, okay? Just especially when you have to be looking down for too long through the day, is that is part of your job. Or if you're spending a lot of time in the kitchen cooking and doing the same thing, steering and looking down for a long time. So that will help to maintain a better posture. It is very important the kind of support that you're giving to your neck when you go to bed. The best is using a neck roll like this. This is soft, and the idea is that the support that we're offering to our neck is just to feel the space, the normal lordosis that we have on the cervical spine. This is to be used especially when you're on your back, lying down on your back. That is a good support. If you're already tight and you feel pain or you're having those headaches, maybe you need something more to support you. So this traveler pillow that is a little thicker also will give a good support when you're lying down on your back. Sometimes the firmness of your mattress has a lot to do also with your neck pain. If it's too soft, your body will sink in it, be sleeping with your head forward. Or using too many pillows on the back of your head is not good either. So think tonight when you go to bed, how is the support? How long does it take you to fall asleep? And how rested are you in the morning? Are you waking up with that headache? Maybe it's because you're not giving enough support or proper support to your head and your upper back. And remember, exercising is really important. I hope this session was very helpful. Take care. Bye-bye.